And let's bring him in, our good friend, Dr. Joe Congini from Akron Children's Hospital Sports Medicine Center. Talk a little sports medicine. Joe, what's on your mind on this Wednesday?
Hey, Ray, you know what? Gosh, we set records locally and nationally of people watching football this weekend, didn't we? The Browns-Steelers games. The Browns-Steelers game had the highest rating since the Super Bowl, and the Ohio State National Championship game had a lot of people watching. And, of course, there was the glow of the Steelers win for Cleveland fans, but the Ohio State loss was disappointing. But I was going to talk sports medicine-wise. You could see in that game, and gosh, two Titans go after each other like that. There really were a lot of injuries in that game, and some people that were a little banged up going in, but a lot of people that were very highly regarded in the draft. And you can kind of get to see, Ray, why some young players now skip the bowl games because the draft is only a few months away, and they really only have one chance to make some money in football. And so you see things like even the great Devontae Smith's injury late in the game was intriguing, and Wyatt Davis, the great lineman from Ohio State's injury, could be one that's a tough one with his knee that needs to be fixed. And Jalen Waddle is another player. There were injured players all over the place. But the one that was most intriguing to me was the Trey Sermon injury that happened on really the first offensive play of the game.
Mm-hmm.
And Trey Sermon meant so much to Ohio State. So, looking at it from a sports and football part of it, wow, that really changed the game. He had been looking so good. But it was very strange. You could see that he had a look that he was really uncomfortable when he got up, and he went to the sidelines. They took him back. They didn't go to the tent with him. They went back to the training room, and you saw pictures of him holding his collarbone throughout that walk back there. And even back in the tunnel, you could see him still kind of holding the left collarbone. And there's not a lot written about it. I've tried to read as much as I can. I'm not exactly sure. But what was strange about it, so holding the left collarbone, he looked out of sorts. And they did an X-ray, being in a big stadium, like they were in a professional stadium, the Hard Rock Stadium. They had an X-ray unit there. They did an X-ray there, and then instead of watching him on the sidelines like you typically would with a collarbone injury or a clavicle fracture, they actually transported him to Broward Hospital, and that had me scratching my head a little because there's a handful of things that we look at in injuries and on the sidelines that can be more severe that would say, hey, we got to look at this thing in an emergency room. Most things, people come back onto the sidelines. And so when he went to the emergency room, that was concerning. And one of the things is the fracture. There may have been a fracture, may have been unstable and needed to be fixed or stabilized in an emergency room that you can't do at a stadium. But the other thing about this injury is in the collarbone, Ray. Most injuries occur to the outside of the shoulder, a separated type shoulder to the collarbone, and those are really heal pretty well. We watch them over time. You'd come back in a sling. But if it's on the other side of the collarbone, there's an injury that we see sometimes in wrestling and football to the sternoclavicular joint, and that's where the breastbone and the collarbone meet. When there's a fracture there, the problem is there's a couple of really important structures around there, and if it's a bad enough fracture that could compress or pinch on important structures. So some of the important structures are like the trachea, which is the windpipe, the vocal cords. Some of these kids will be kind of hoarse and they can't talk very well. It can compress the esophagus and they start drooling and other things, or it can compress and actually injure the lung again, like we've had some lung injuries recently. So sometimes something that can make injuries unstable that we look for on the collarbone, or if they're on the other side closer to the middle of the body where there's some really important structures. But anyway, I've not heard anything about what exactly happened with Trey Sermon. He didn't come home on the same flight as the Buckeyes back. He took another flight the next day, but he did come back. And as mother said in an article, he's recovering. But whatever, it was just a little unusual that his collarbone fracture or shoulder fracture was bad enough that he needed to be sent to the emergency room. Clearly, it affected the game. Clearly, it was a hard-hitting game between these Titans, and a lot of injuries occur in the sport of football. And that is a reason why a lot of people skip that last game to try to get ready for the draft. But that's part of what might have been some of what goes through. Those are injuries that occur in high school kids in the inside of the clavicle, closer to important structures like the windpipe, that we have to be aware of, and we teach trainers and sports medicine people to be aware of those kinds of injuries that can occur that are more emergent, where somebody needs to be seen in an emergency room.
Joe, with Wyatt Davis and the knee injury, like you said, that could really affect what he's doing. He's a junior. Many people were speculating that he would come out into the draft and be a first-round draft pick. Now with that knee injury, there's question marks. Does it serve him better to rehab and go back to Ohio State next year, or still come out? And we'll wait and see. But with Trey Sermon playing the running back position, where you're going to get bopped and hit and catch the football and such with a broken collarbone going forward, and I know you don't know the details of his collarbone situation and such, but how difficult is that to be an NFL running back with that on your injury resume?
So I don't know the situation at all, but the vast majority of clavicle fractures, collarbone fractures, are of no long-term significance at all. They heal really well. You and I have talked on this show a little bit of a change in the last 5 to 10 years of high-level sports medicine, even high level of serious high school kids, is they will now sometimes put hardware in there and fix it with a rod or a pin and and fix it. But after that gets fixed, that bone is usually very solid and does not trouble people again. So for routine collarbones, no big deal at all. If it's way to the inside and it had any other complications to it, sometimes those can be tricky. But typically overall, for people to know about collarbones, no real, very, very rarely any long-term implications other than pain and problem for about 6 to 8 weeks waiting for that bone to heal.